Good afternoon, and thank you so much for joining us today. My name is Samantha Holvey, and I'm the Director of Community and Education here at WEDI. And I'm kicking off today's work group open house, which I'm very excited y'all have joined us for. I've been managing the WEDI work groups for about 10 years now, and I'm so excited about how much they've grown, different directions that we've gone in, and the amazing co-chairs that lead these work groups that you'll be hearing from today. So without any further ado, I want to go ahead and introduce our almost like the moderator for today, Miss Pam Grose, who have been involved with WEDI ever since I've been here and is just such a powerhouse and such a fantastic leader for the work groups here at WEDI. Pam, it's all yours.
Thanks, Sam. Welcome, everyone. Thanks so much for attending. We're so excited to share information about all of our work groups. I am one of the co-chairs of the Work Group Leadership Committee, which provides some oversight to our work groups, as well as one of the co-chairs of the Data Exchange Work Group, which provides oversight for some of our sub-work groups. So again, very excited to share information about our work groups, everything that we have going on, and hopefully get you excited about some of them and potentially join. First, I want to share a little bit of information about WEDI itself, just for some level setting. WEDI was formed in 1991 and has been named in the HIPAA regulation as an advisor to the Secretary of HHS. We work closely with every administration that comes in, and we have productive working relationships with CMS, with the Office for Civil Rights, and the Office of National Coordinator. So we work very closely with different government entities to make sure that we are providing insight into what's going on in healthcare and being able to, again, advise around the challenges that happen there. So next slide, please. We do that through consensus. We bring together diverse industry stakeholders. We have more than 350 member organizations, and we do our work through work groups, through open public forums, through policy advisory groups and technical advisory committees. And you can see here all of the different kinds of stakeholders that we bring together to talk about the challenges that we all experience in healthcare and what are some best practices and some ways that we might overcome those challenges. And then we provide information back through regulatory tracking, through our work groups and listservs, through conferences, forums, and webinars. We provide testimony and comment letters back to CMS. And we have special initiatives as well when something really unique comes up, for example, the No Surprises Act. Next slide, please. So as an industry convener, bringing together all of these different kinds of stakeholders, our mission is to provide leadership and guidance to the nation's healthcare systems on how to use and leverage our industry's collective technology, knowledge, expertise, and information resources. And our ultimate goal is to improve administrative efficiency, quality, and cost effectiveness within healthcare. You can see on our wheel here all of the different ways that we try to leverage the knowledge and expertise of our stakeholders and participants, and the way that we give that information back to the industry. And you can learn more about us and even about becoming a member at wedi.org. Next slide, please. So within our work groups, that's one of the ways that we bring together the different stakeholders that we have and talk about the challenges that we're all experiencing. We provide thoughtful leadership and common sense approaches that enhance the exchange of clinical and administrative healthcare information. Our work groups collect input, exchange ideas, and make recommendations that can inspire impactful and far-reaching change in the industry. So you can see here on the slide the different work groups that are going to be presenting information today. We have a lot of information to present to you. So hopefully some of this will be informative to you and get you excited about joining some of our work groups. Next slide, please. So if you do have questions, please use the chat feature to ask your questions, and we'll try and get those addressed. The slides and recording will be emailed after the event. And if you want to join a work group, a sub-work group, or a task group, if what you hear today really excites you about a specific topic, then please contact Sam Holvey, who spoke at the beginning. Here's her email address. And if you're not currently a WEDI member, but you want to learn about being one, then please email Bill Alder, and here's his email address. So now we're going to get started. We're going to jump in with a new work group that's just starting, our Health Equity Work Group. And Ed Hafner is going to present the information on that. So Ed?
All right, thank you so much, Pam. Let's go to the second screen. I was going to tease you since you've been here as long as Sam can remember. I think we started about the same time. I was going to make fun about our age, but I can't though. So the Health Equity Work Group, it's brand new, guys. We've just was approved by the WEDI board. It's based on the popularity of much of our education. Probably the past couple of years, we've held a number of different health equity education events. It was really well attended. We had some outstanding experts across the country and many different companies and different organizations present to us. And it was so popular. We found there was a big interest in allowing for us to share successful practices and challenges with health equity, particularly what's related to data, data capturing it, sourcing the data, using third-party resources, utilizing the findings of that analysis, and to be able to share our successful practices and again, our challenges with one another. It will be something that will hopefully be run by folks that have that strong background, whether it be within someone who's an expert within your organization being a co-chair, or one of those educational leaders that has presented before leading it as well. It will be mostly a discussion panel at the beginning. They'll probably most likely have a short presentation and then have a lot of discussion amongst each other. And I always find that with WEDI in general, it's really a safe space, a warm setting to share information back and forth to each other. So that's what we're hoping to do for our discussion groups. We would like to eventually, hopefully, land on a very interesting topic and perhaps do surveys and do some white papers as well. Of course, if we find things that will cross over to other work groups or sub-work groups, there will be a lot of coordination, just how like emerging technology works with other work groups. We'll do the same with health equity. So if you have any questions, please let me know. At the end of the day, we'll be reaching out to co-chairs here really soon if we haven't already done that. Will be a general calling for co-chairs. There'll be a selection process, and then will be a call out for people to join the work group. So hopefully you'll find this one very educational and rewarding. All right, that's me.
Thanks, Ed. So next we'll go to our remittance advice and payment sub-work group, and I think Pat is going to start with this one.
Thank you, Pam. So I'm Pat Wetak. I work for Cognizant, one of the co-chairs, along with Pam Grisey, as we had on the slide. So who are we? The purpose of our sub-work group is to focus primarily on healthcare business processes and challenges related to payments and the remittance advice, as well as promote adoption of electronic transactions for remittance advice and payments. What's in our scope? Well, our responsibilities include adhering to all WEDI policies and procedures. We report up to the work group leadership, to the data exchange work group on a monthly basis, using some templates that have been created that allow us to give a very nice, distinct status on where our group is. We are technology vendor solution agnostic, and I think that that's really important to understand. Our primary goals are to provide a forum for all the stakeholders to address business issues that are related to the implementation and use of both remittance advice and payment transactions. Now, let me just kind of jump in there. When we talk about payment transactions, we're talking about EFT, check, sort of that side of the house. We also provide educational guidance and best practices for issues related to, obviously, remittance advice and payments. And we participate in the WEDI activities in providing input to CMS and HHS as appropriate. Next slide, please. So what are some of the things that we have done recently? We published a paper and then presented at the WEDI conference session on updates to the NACHA operating rules. We conducted a survey on fees for EFT that was done at the request of CMS. We published a paper and presented it at the WEDI conference on the usage of the PLB segment in the A35, multiple appendices including interest, overpayment recovery, and regulatory adjustments. We provided comments to the NSA task group on the QPA in the A35 transaction. we published a paper on payments sent to incorrect entities. And we also presented a Remittance and Payments 101 webinar. Now I'll hand it back to Pam.
Thanks, Pat. So currently, our work group is working on a paper looking at remittances that are sent to providers from business associates that health plans contract with to perform that service for them. And once we complete that, the paper is focused on remittance advice, and then we're going to look at the same topic, but from a payments perspective, and we're going to make some updates to an existing paper, the Guiding Principles for Electronic Payments, again, for payments made by business associates of the health plan. And we don't have it on our slide, but we also have been taking a look at the recent guidance documents that were put out by CMS on both business associates of health plans and also payment by virtual card, and have been preparing some comments to send back to CMS on those guidance documents. So we're just about done with that, but we have quite a bit of work on our plate, and we do have a couple of additional requests that CMS has made that we'll be taking a look at as well. Next slide. So if you'd like to join our group, we meet on the first and third Monday of every month at 11 Eastern. And again, if you're interested, you can contact Sam Holby. Next slide, please. So now we'll move on to telehealth and to Jill and Nancy.
Hi, I'm Nancy Spector with the American Medical Association, and I'm gonna run through our overview of our work group. And Jill Dominic from Anthem is co-chair, my co-chair with the telehealth work group. And I'll ask her to jump in and in case I forget anything. So just to give an overview of our work group, we are focused primarily on business processes and challenges that relate to the workflow for telehealth and the exchange of data for telehealth services. And so what we do is look at business cases, return on investment, data exchange, just the overall functions of telehealth service and how it fits within today's healthcare system. And in doing our work, we look at the perspective from the providers, payers, vendors, and patients, and how that all fits together to make up the delivery of telehealth services. So that I think the scope there is probably covered by our purpose, but scope is, looking at business cases, return on investment, data exchange related to telehealth in the healthcare system. So next slide. This is a list of papers, work products that we did over, I think, just the last year and a half. So you can see here papers that we've done. These are all available out on the WEDI website. If you go under the Knowledge Center, you can find all the papers there. And so our information is there along with all the other work groups. And from a presentation standpoint, this was one presentation that happened last year. I feel like we did some others, but when I put the slide together, I either missed something or I'm thinking about work that we did the previous year. But we've done, different standalone webinars, and we've also had sessions that have been part of our overall spring and fall conference as well. And so again, we try to stay pretty active with presentations around telehealth. So next slide. We are currently working on a paper that talks about the integration between standalone telehealth platforms and the EHR, and then what barriers there might be about integrating that data. So that's a paper we have just started working on. Jill put together an outline, and I've started playing around with doing some of the writing. Our work group process is usually that we try to have an outline and on our calls, we'll go through that outline, or if we've got some of the content drafted, we'll go through that and look for input from the work group members participating, and get their input on what's been drafted, either by the co-chairs or anyone else within the work group who has volunteered to provide some content and who's added anything into the paper. So it's a collaborative process that we go through in creating the work products. And we try to bring in as many people as we can to help with authoring, writing the content. But if you're participating in a work group, don't feel like you're going to be put on the spot to, or at least our work group, that you won't be put on the spot to do any particular assignment with any of the work that we're doing. And that's the paper that we're working on right now. Presentation wise, when I put this together a couple weeks ago, we were anticipating that we would have a session at the spring conference, but the way that things worked out with the sessions and all the speakers and content, we ended up not getting a session. But what we are planning is a spotlight event. That's currently in the planning phases by Michael, and Jill and I are helping to provide input on that. And as of this morning and our latest email exchange, it looks like we're going to be scheduling something in July, and it'll probably be somewhere. We're still, again, working on speakers and topics and content, but anywhere from like a 2 to 4 hour block of time that would be a spotlight. Definitely, I think more than 2 hours, but like a half-day event on this. And if you have any ideas for topics you would like to hear about, let us know. And if you have any recommendations for speakers, also let us know. We're thinking that we'll do a bit of a regulatory update. We'll have a keynote speaker, and we're looking to do some payer and provider panel talking about the current happenings around telehealth and what we're seeing. Everybody knows how telehealth really took off during the pandemic, and so we'll be talking about the current status of telehealth. So next slide. So this is when we meet, the fourth Wednesdays of every month at 2 p.m. Eastern. Jill, is there anything that you'd like to add?
I don't think you missed anything. I just wanted to add that we always have hot topics as a discussion at our meetings. And right now we're going to be looking at the PHE expiring and what kind of changes we might see in telehealth services as a result of that.
Great, thanks.
Sure.
Thanks, Nancy and Jill. Now we'll move on to the Acknowledgements subwork group with Jessica and Tara.
Hello, everyone. This is Tara Rose with Optum, and my partner in crime co-chair, Jessica Malsom, is also on the call with us today. I'll take primary, and Jessica will add as she feels needed. So next slide, please. So the Acknowledgements work group, we focus mainly on business process and education around all of the acknowledgement transactions, and those are claim acknowledgement transactions. We really are trying to get adoption of those transactions. They are not currently mandated for HIPAA, but we do see a huge change and some positive turnout when the acknowledgements are used, when it comes to billing your claims and being able to get them paid in a timely manner and dealing with rejections so providers can get paid in a timely manner. Our scope is truly just that, anything acknowledgement. We do offer a forum for stakeholders. Like all other work groups and sub-work groups, we're a very collaborative group. We value all input from every stakeholder that attends our call, whether it's a stakeholder that attends from time to time or who is a fixture within our sub-work group. We do participate in WEDI's mission to provide CMS and HHS recommendations when appropriate and when asked for from the group. So we will draft those when needed. And we will continue to drive adoption of these acknowledgement transactions, even though they're not mandated. And our next goal is to also identify some ROI around acknowledgement. So there'll be a survey coming out for that very soon. Next slide, please. So recent work products that we have completed, we've done an acknowledgements overview, which breaks down all the acknowledgement transactions and what their purpose is, but it's super high level. And we did complete the 824, which is the application reporting for insurance overview. This one wasn't as detailed, but we are going to do something you'll see on the next slide to provide a more detailed overview of that transaction. We've also done a webinar of the acknowledgement overview, and we hope to do more of those coming in the future. So next slide, please. This is the more fun slide. So what we're currently working on, we're working on the implementation acknowledgement for healthcare insurance issue brief. That's the 999. And it's in 5010. We will update those as we go to different versions. And we're also looking to expand the application reporting for insurance 824 issue brief to include attachments. Since that's being used as a huge response to attachment transactions, that 275. So we're going to expand that as well. And as I mentioned earlier, there's going to be a new survey to help identify the challenge and reasons why entities haven't implemented acknowledgements. We'd like to hear from those and try to provide some guidance and increase adoption of those, because there's a lot of value in receiving these acknowledgements transactions back from your payers, from your clearinghouses. The survey would also help us identify the ROI for implementing acknowledgement transactions. Those of us who use acknowledgements today see the total benefit, and we want to be able to share that with everyone and anyone who hasn't adopted these transactions yet. And as an additional take on, we have decided to review the work group of claim status, their 277 project, to see if we can help roll that out. Because I know they're looking for co-chairs for that work group. So little nudge there for Pam. So hopefully we can get someone in that group as well. So we'll be taking that on. Next slide. And we would love to have you guys to meet with us. Good news is that we are going to have a session during the WEDI conference on Monday, the 23rd at, I want to say 3 p.m. Eastern. So that will be added to the agenda. We would love to have you join us, even if you just want to sit in and listen. Maybe get excited about being a part of our work group. And we do have some upcoming meetings, as you see the notes through the end of the year. We are discussing expanding our meetings and meeting twice a month because of the amount of work that we do have to do. So there could be more dates added to this. This is just what we have today. So please come join us. We'd love to have you. And Jessica, did you have anything to add?
I think you covered it all. We are looking forward to seeing some new faces attending our meetings.
Great. We look forward to seeing you. And back to you, Ms. Pam.
Thank you. So now we're going to move to the provider information subwork group, and Michelle.
Good afternoon, everyone. Thank you for joining us. Pam, thank you. If you could go to the next slide. Our purpose in our provider information subwork group is to really drive provider information and how provider information determines how effective we are in the healthcare industry in engaging the provider for reimbursement from a claims perspective, provider directories, credentialing, et cetera. So again, our purpose is really to drive that educational opportunity. We would love to have everyone and anyone that can join us. We are not turning anyone down. I think Tara had stated earlier, we would love for the participation from across all spectrums, vendors, providers, and really having the opportunity for our health plans to join in this great work group, subwork group. We also look at what is current provider information, what level of data is exchanged. So we have come a long way since 2018, and we're looking at continuing to conduct webinars, educational forums, work group sessions. Again, we've got several work group sessions coming up in the spring conference, summer conference. We are also having other opportunities throughout the year to bring everybody together to take a look at what we can do effectively with provider data. And again, having the level of information exchange addresses and identifies specific business needs. So we look at that as well. We also take a look from across all of healthcare. And again, we're looking at how we're exchanging provider information. Somebody asked me a couple of months ago, what is your definition of a provider? Provider is anyone who is a human individual or a brick and mortar or an atypical provider that provides services to consumers of healthcare, members, beneficiaries. So again, just wanted to make sure that everyone is good with that because that is what we focus on. And then the scope of our sub-work group is really around taking that information, how we identify educational opportunities. What is the focus? Like right now, no surprises. So what is included in no surprises around provider directories? Yes, provider directories are a part of no surprises. So again, having a team talk about the new even state regulations, like in California, there's different opportunities. So we have representation from the California industry around the state requirements. So again, looking at all of that data, what is the best meaningful way to communicate provider information? And again, we look at best practices, workflows. We talk to providers. Actually, we have providers on our sub-work group. And again, listen to effectively determine how we can educate and inform. Provider data is critical to everything we do in the healthcare industry. So again, we would love to have you join us. If you can, Pam, go to the next slide. Couple of things that we're working on, and this may be a little small, but I wanted to point out we're continuing to keep our webinars up to date. We are working on an opportunity to do a series of podcasts. One is going to be focused around provider directories in itself. Provider information is the second one. Third is provider credentialing. Fourth is provider credentialing, contracting, and networking, and how that all plays back up into provider directories. So again, be on the lookout for a lot of really good podcast series coming soon. WEDI Spring Session again, we're looking to conduct a work group session on the 23rd. I think we're scheduled from 2 to 3. So again, be on the lookout for that opportunity at wedi.org. Also, if you're interested in becoming a member of our sub-work group, again, please feel free to reach out. We encourage everyone to at least come in and participate and hear and see what we do. Pam, if you could go to the next slide. Thank you. And again, keeping in mind, we're really looking at provider information, provider data. We keep saying provider information because provider information is changing. It's no longer really just data. It's information that consistently changes. So we want to make sure, one, we're focusing on that. So we're creating opportunities. We're looking at the rest of our 2022 and looking at 2023. So we're going to be putting in some project proposals in third quarter of this year. We're also looking at opportunities to participate with other industry organizations, Gravity HL7, Social Determinants of Health, Gender Harmony, Course X12. And then we're going to continue to do provider information 101, 102 webinars as we continue to get very deep into provider information. begin additional project proposals, as we stated, looking at use cases, real live personas, and then talking about our project redesign. What is that going to look like over the next 3 years? And then we're going to continue assisting new members coming on board. We would love, again, to have you join us. And we also completed moderation for the April 26th session regarding provider directories. This is also something we're going to continue to talk about. I don't think that is going to go away anytime soon. I think we're going to see more opportunities, and I'll say it that way. So again, participate if you can. The WEDI 2022 Spring Conference, May the 23rd through the 26th. And last but not least, our last slide here, we meet every second Wednesday, and we were scheduled to meet today. We are not meeting because this session will actually take us over. So we canceled today's session, but the second Wednesday of every month. So Pam, I'm going to turn it back to you.
Thanks, Michelle. So now we'll move on to the prior authorization subwork group with Heather and Janice.
Hey everyone, it is Heather McComas for the American Medical Association. Thank you so much for being here today. I am one of the co-chairs of the WEDI Prior Authorization Subwork Group, and we focus on identifying challenges and barriers to automating the prior authorization process and finding solutions and best practices for the industry to address those issues. We have active participation across stakeholder groups, and I'm sure you can all imagine that because this is a bit of a controversial topic, we can have some lively discussions, but it is a safe place for everyone to discuss ideas, and I think our work products are stronger because we have such strong participation across stakeholder types. Our goal is to, encourage all stakeholders to adopt a standard electronic process for prior authorization to reduce administrative costs and also, most importantly, to reduce patient care delays. We started out focusing on primarily just the prior authorization main request and response transaction. More recently, we've gotten into talking about inquiries on prior authorization status. Janice will talk about that a little bit more in just a moment. And then also our subgroup members often participate in ad hoc WEDI activities on regulatory comments related to prior authorization. I'm sure that many of you have been aware there's been a fair amount of rulemaking activity around prior authorization in the past year or two. And so WEDI convenes groups to put together comments, and we let our work group members know about that. And oftentimes they participate in those kind of separate groups. Go ahead to the next slide, please. So in terms of our recent work products, we did release a white paper, Prior Authorization Workflow Barriers and Guiding Principles, last fall. It includes some kind of baseline assumptions for automating the prior authorization process, and then a set of guiding principles. I encourage everyone to take a look at that. It is available on the WEDI website, and we did present an overview of that paper at the fall WEDI conference last fall. And then, as I mentioned, we do participate in WEDI activities related to prior authorization, and several of our work group members did participate in a WEDI group that formed to develop the WEDI's comments on the recent Office of the National Coordinator electronic prior authorization request for information, and that letter was sent in March of 2022. You can go to the next slide, and I believe Janice is going to pick it up from here.
Hi, this is Janice, the other co-chair. We're talking about what we're working on right now, and honestly, originally we were planning on meeting once a month. We've been meeting for twice a month since we started several years back, and we kept thinking as things slow down, we'll go to once a month, but that's not going to happen. As Heather said, it's a pretty lively transaction. A lot of interest has been focused on it over the past year or so, and it doesn't seem to be dying down. The white paper that Heather was talking about, which I encourage you to take a peek at, and it's got flow charts and I guess levels of ways to reduce challenges to prior authorization submission based on, as Heather said, a very lively group, and everybody's back-end systems and processes are quite different, so it's certainly not a one-size-fits-all. But after the white paper was done on challenges for the submission for the prior authorization itself, what became obvious was now you have a group of people that need to have this information available to them. So the prior authorization is out there, but manual processes still needed to take place. You had somebody who was submitting that transaction, and they needed to get information out. And we were trying to decide, ways we can communicate that people can gather this information themselves. Again, the transaction, one of the major criticisms of prior authorization was it's electronic up to a point, and then it seemed to go off into manual directions. So we were discussing the electronic inquiry transaction and making, how that's available for, provider groups within that original prior authorization transaction. Again, everybody's back-end system is different, and there's different levels available on how we're looking to tackle that, but certainly the focus now is the prior authorization is out there, and how do the people that need that information get their hands on that information. And one other thing is, we were looking at really, which issue should we tackle next, and we're usually voting on which challenge we would be doing next. So there's certainly no there's no absence of challenges for us going forward. We do meet the second Tuesday of every month. The first and third Tuesday of every month from 1:30 to 2:30. Please join us and join the conversation. Everybody's welcome. Thanks.
Thanks, Heather and Janice. Now we're going to talk about the claim status subwork group, and Beth Davis is going to talk about that.
Good afternoon, everybody. Thanks for joining us. My name is Beth Davis. I'm with Allscripts, and I am representing the claim status inquiry subwork group today. It's currently on a hiatus, but we're about to ramp it back up again, and I'm excited about that. We hope to have a co-chair in place within the next couple of weeks, and some exciting topics to begin discussions on. The claim status inquiry is greatly underused, and there are some areas where we can really improve that usage just by identifying and solving for some of the shortcomings for that. So we are looking for an additional co-chair. So we'd like to have 2 for this group. And we'll be getting that one started up, and hope you will join us. That meeting cadence will be established and publicized when we ramp it up, but do join and help us get that started back up. It's going to be interesting. Thanks, Pam. Here is a list of some of the work products that were either in progress or being considered that may or may not be something that the newly established work group does. But that last item about the claim not found kind of status is one that we're really interested in pursuing. Why isn't this used as much as it should be, and what can be done to solve those issues? Are they technical? Are they process related? What are some of those areas, and how can we solve for them? Thank you.
Thanks, Beth. Now we'll talk about the dental subwork group, and I'll just talk about this real quickly. This is another subwork group that's on hiatus because we're looking for a co-chair. So next slide, please. So if you are interested in the dental space and interested in a leadership role here, please contact Sam and let us know. The dental subwork group is focused on challenges with the exchange of information related to the dental industry across business processes. So not focused on only the claim, only the payment, but across all the business processes, but specific to the dental industry. So because it crosses business processes, this subwork group coordinates with other subwork groups as necessary when there's overlap. Next slide, please. And most recently, this subwork group created a paper discussing interoperability within the dental space, and they had planned to work on a paper discussing eligibility and benefits challenges within the dental industry. So again, we're looking for co-chairs here, and if you're interested in that, please let us know, because we'd love to get this subwork group back up and going. So now we'll talk about the emerging technology subwork group with Sherry, Randy, and Ed.
All right, Pam, I'll take the lead on this. Hello, this is Ed Hafner. My co-chairs are Sherry Holmes-Henry from NextGen and Randy Swift from Citius Healthcare. I believe Sherry just did join. So Sherry, help me out if I
will. Hello, everyone. Thank you, Ed.
You're welcome. So the purpose of Emerging Technology Subwork Group is really to engage WEDI membership in introducing emerging technologies and trends and in sharing experiences, to educate those on those technologies, but also to hear about how they're being applied in your place of work. The scope of the work is that as we start crossing over into other areas that other work groups do, we actually will coordinate with them to make sure there's a nice handoff. So for example, on prior auth, we handed off some of our prior auth fire type APIs over to the prior authorization subwork group. Next slide, please. So I want to show off some of the things that we've done recently. A few of these may have gotten back to 2020. I have to look at my calendar, but we did review a number of the different Da Vinci use cases and got into some detail there. We talked about some of the technology challenges related to the No Surprises Act AEOB. That was when the act first came out. We talked about some of the technologies related to part 1 and part 2 as well in a later discussion. We had a discussion on NLP and the different applications. Was a really interesting set of examples that were given on the provider side on that particular recorded session. We also did a deep review on fire and related technology related to the prior authorization rule. We previously in 2020 covered the interoperability APIs and the proposed rule that was put on hold. We covered, Randy actually covered robotic process automation and RPA and different sort of applications there on both the provider and payer side. And we did a review on authentication technologies for UDAP. There was also, let me see here, for 2020 sessions, we had a panel discussion with several payers and a vendor that talked about different payer trends from a technology perspective and how it relates to their business practices. We delved into deep into a topic and into patient matching. Sherry introduced the topic for parts 1, and we had a further discussion on that gave examples of patient matching being applied in technology, software vendors, as well as having Karen gave an update on the digital ID progress. Sherry, anything to add to this list?
No, I think you covered it, Ed. Thank you.
Okay, sure. Next slide, please. We're a lot like Lauren Michaels and Saturday Night Live trying to queue up different entertainment technologies going forward. One that we've just come across was some of the, as people are becoming more comfortable with the cloud environment, there's still some technical challenges related to security and reliability, and to really dig into some of the different hurdles that people have had to make to be able to accommodate running your applications in the cloud. We are working with HL7 leadership to try to get some insights into things like accelerator projects like Helios and Codex and a number of the other ones. Certainly getting into clinical exchange use cases and how that's being successful, in certain geographic areas. There's machine learning applications that we'll be digging deep into, and we'll come back to NLP applications. So those are the kind of topics that we have on board. Typically, we give about a 15-minute presentation from a guest speaker, or perhaps one of our co-chairs. Sherry's done a number of them, and Randy as well. Then we go ahead and conduct and moderate discussions for the next 45 minutes. So encourage you to check us out. They are recorded, so that's our work product. It's actually a recorded sessions, and you can find us on the WEDI site under the member section. Sherry, anything else to add?
Just, we'd love to have you become engaged and involved. And thank you so much, Ed, for covering it.
Yeah, you're welcome. And we meet third Thursdays of every month, unless our speaker asks us to change. So sometimes we may have to do a Wednesday or a Friday or whatever. So stay tuned and get subscribed with Sam Holvey, and she'll be able to keep you on the list to keep you updated.
Thanks, Ed.
You're welcome.
All right, now we'll move on to eligibility and benefits with Donna and Deb.
Hello, I'm Deb McCatherine, and I'm not sure that Donna's going to be able to join us. She has a conflict, but we are the co-chairs of the Eligibility and Benefits Subwork Group. Next slide, please. So our purpose is to focus primarily on healthcare business processes and challenges related to workflow for eligibility and benefits related to the workflow for the eligibility and benefit transactions, and to promote adoption of electronic transactions for eligibility and benefits. The primary goals of the eligibility and benefit subwork group are to provide a forum for all stakeholders to address business issues related to the implementation and use of the transactions, and to provide educational guidance and best practices for issues related to the business processes and challenges of the eligibility and benefit subwork group. Next slide, please. So our recent work products are, we have done a survey on topics of interest to the subwork group, and we have been working on an issue brief, excuse me, on tiered benefits. And the way that has been emerging is we spent a lot of time narrowing down the scope of that, because tiered benefits is a very broad topic. There are a lot of different scenarios that can include, including tiering based on providers or by the patient status, or by, for instance, with a benefit, it could be a number or quantity of the service being provided. So we did a lot of brainstorming work to see how we wanted to present that in our issue draft, our issue brief. What we have ended up doing is to make this an iterative process so that we publish several different drafts, several different issue briefs on this topic, so that you go to a scenario, for example, when we get them all published. Say, for example, I just want to know what to do when I'm dealing with a network provider versus an out-of-network provider, and how would I handle that versus a more complex situation, such as, I have a patient who has a special coverage because this patient is an employer of the provider, and so it can get more and more complex as we go on and generate our iterative briefs, and these will be separate publications so that we. You can go to the one that fits the need that you're interested in and get educated on that. And we'll build in complexity as we move on. Next slide. We are currently, as I said, completing the first iteration of the issue brief on tiered benefits and determining the scope of future iterations. So we're focusing primarily on that right at the moment. Next slide. And our meetings are the third Wednesdays of the month at 2 p.m. Eastern time. So please join us.
Thanks, Deb. So now we will move on to the claims subwork group with Stanley, Beth, and Chuck.
Thank you, Pam. It's Beth again. And my co-chairs, Stanley and Chuck, are on the call as well. You're welcome to chime in.
Good afternoon.
Hey, was that Stanley?
Yep.
Okay, thank you. I'm sorry. Okay, so the purpose of the claims sub-work group is to focus primarily on the business processes and challenges related to the workflow for claims, promote adoption of electronic transactions for claims, facilitate implementation of electronic standards and business processes, provide forums for discussions and education, in creating white papers, work products, educational guidance, best practices for use of electronic claim standards and related workflows. Sorry. So this is a fun work group. We have a lot of really good discussions. We get really down into the nitty gritty, and we work very well together. We'd love to have you join us. Next slide. The recent work products, this looks pretty skinny here, but there's actually a lot that have gone into this. We've contributed a number of data points and questions and information to the No Surprises Task Group, which you'll learn about shortly. We've produced a white paper and published that on our website about the best practices for secondary EDI claim submissions. We've done a paper on the reducing unnecessary duplicate claim submissions and reporting on appropriate use criteria for advanced diagnostic images. All those are published on our WEDI site. Stanley, would you like to speak to any of these?
Just that they contain a tremendous amount of detail and practical suggestions identifying both the issues and the solutions that providers and health plans and vendors can all undertake to improve the claims process.
Thank you. All right, next slide. We are currently working on, spend a lot of our effort around the No Surprises Act. Basically, we're working on the good faith estimate, business processes with some emphasis on the convening provider subjects. Again, contributing to the No Surprises Act task group. We're always looking for new ideas related to claim business process, and we're always looking for ways to get provider and patient input. We have, between 10 and 50 who participate in our meetings and our work groups, and we contribute a lot to advisory comments on recent and proposed and enacted legislation. So please do join us. We'd love to have you. Next slide. We meet on the second and fourth Thursday of every month. We will also be meeting on the 23rd during the conference, and you're welcome to attend. Thank you.
Thanks, Beth. Now we'll look at the property and casualty group with Sherry.
Good day, everyone. I'm Sherry Wilson, co-chair of the P&C work group, along with Tina Green. I'm going to go to the next slide, please. So in terms of purpose, our work group's primary focus is on business challenges, regulatory stakeholder impact, and collaborative solutions to relate to property and casualty industry. In terms of our scope, what makes our work group unique is that the property and casualty is a legal system governed by 50 individual states and not a healthcare system. So a little bit different than some of the other work groups, but still the same goal to EDI automation. Our stakeholders, of course, include states, payers, providers, and third-party vendors. And the work group also serves as an industry education resource through relevant webinars, state eBill regulatory resources, and white papers. Next slide. So in recent work products, I'd like to just highlight 3 key work groups efforts. One is a white paper we're doing on property and casualty code value usage guidelines for healthcare payments. And what's important about this paper, the purpose is to identify the challenges faced by property and casualty industry when mapping proprietary claim adjustment reason codes to national code set. And the real issue here we're addressing is that states and property and casualty payers have several hundred to 1,000 of proprietary claim adjustment reason codes. So you can see which is the major stakeholder challenge. And this paper provides guidance related to specific P&C business use case scenarios, and then how to map priority codes the appropriate national code set. And this work group is a great example of stakeholder collaboration efforts, especially with the states and payer community participation. So very exciting project we're working on. The second highlight is a summary of eBill state regulatory resource reference table. Very long word here, but this is an exciting WEDI resource tool. This is a living document that we update accordingly, that provides industry stakeholders with a single national regulatory resource reference across all the eBill states. So what's really great about this reference tool, it's a great one-stop stakeholder compliance resource. You can be able to access information on the WEDI site under the Property and Casualty Workgroup section. So that's exciting. And third, as we stated earlier, the work group provides ongoing stakeholder education webinars, and we just listed a great example. It was a New York Workers' Comp Board webinar where they came and spoke on the new CMS 1500 XML regulations and stakeholder compliance requirements that will go in effect July 1, 2022. Again, if you have an interest in this topic, the webinar is recorded and the PowerPoint is available under the Knowledge Center. Next slide, please. So what we're currently working on, our June agenda will be updating the summary eBill states regulatory reference table. We also have upcoming June Property and Casualty podcast at 3 Eastern time. We welcome you to come and learn about upcoming state regulations and stakeholder compliance impact. And we'll also be discussing 6 key performance strategies to increase first-time property and casualty claim submission, which includes the acknowledgement transactions and electronic attachments. I think it'll be very informative, especially those that have not been involved in those transaction sets yet. And in July, our agenda is to continue to update our property and casualty white paper and to identify new business use case scenarios and associated claim adjustment codes. And then in August, we plan to have a stakeholder planning session for the 2022 fall education agenda. And it's also an opportunity with state roundtable to discuss emerging regulatory landscape. So next slide, please. So we meet the first Thursday of the month. Since I'm Pacific time, I'm saying 11 o'clock Pacific time. But this is a really great workshop to join if you're interested in keeping informed on P&C regulatory requirements. In addition, this workshop provides you with the opportunity to really participate in a collaborative effort to address P&C issues and help move the industry to the EDI national standards. So we hope you're joining us. It's a great work group. Thank you.
Sherry. Now we're going to talk about the Privacy and Security Work Group. The co-chairs, Tina and Marilyn, both had conflicts today. So Mary Lee Stein, one of the other work group leadership co-chairs, is going to cover their information. Mary Lee?
Mary Lee, you can unmute now.
I will go ahead and cover then if Mary Lee's not able to go. So next slide, please.
Okay.
Oh, there we go. Now,
yeah, it told me I couldn't unmute myself. Sorry about that. So the Privacy and Security Work Group focuses on privacy and security issues under the Health Insurance Portability and Accountability Act. We all know and love that as HIPAA, and the Health Information Technology for Economic and Clinical Health High-Tech Act as well as other federal and state laws and regulations. Some of the activities of this work group include conference events, educational webinars, work group meetings, and comment letters. Next slide, please. Some of the current issues that they're working on include looking at cybersecurity threats such as ransomware, interoperability under the Trusted Exchange Framework and the Common Agreement. You might know that as TEFCA. National Institutes of Standards and Technology, or NIST, cybersecurity framework comments, a review of congressional privacy and security legislation, as well as the HIPAA proposed rule on care coordination. Next slide, please. The request for information from HHS's Office for Civil Rights related to security practices and awarding civil monetary penalties to individuals is another item that they're looking at, as well as they will have the HHS OCR Director, Lisa Pino, at the WEDI Spring Conference. And I hope I said her name right. Next slide, please. They meet the second Wednesday of each month at 2 p.m. and this is Eastern time. If you're interested, contact Samantha and she'll get you hooked up. Thank you.
Thanks, Mary Lee. Now we'll look at the payment models work group. John?
Sorry, I was on mute. Thanks very much, Pam. My name is John Cal. I'm currently the single co-chair of the group. We are recruiting another co-chair. Historically, the group has done a lot of education. We're actually looking to get much more into the technical aspects of payment reform so that we can do more proactive education about what's coming down the pike and also support WEDI in making recommendations and contributing feedback into what is appearing to be a very active CMS agenda to really pick up payment reform again. As such, one of our very active members in the group, Mike Patwell from EdFX, is much more grounded in the day-to-day operations with a lot of the payers and providers in the field. So I'm going to let Mike go through our agenda for 2022 and our hopes and dreams for 2023. Mike, would you take it over, please?
Great. Thank you, John, and good afternoon, everybody. I've been a member of the payment models group for the past 4 years. I work with John at EdFX. So if you can just go to the next slide, what we've produced most recently has been a white paper on value-based models. This is something I send out to most of the folks that I work with on a day and out basis, both health plans and providers. This is a first in a series. So this was volume 1, do you know, on value-based payments. Some of the great pieces that were within this document were, very high level, value-based purchasing, payment, value-based care. There's so many terms. So we tried to, distill that. We tried to also interface a lot of the work that John and I are doing also with CAQH, another great member, with the interoperability. And then just tried to distill, the differences between, state, federal, private insurance company models. And it's just a great industry resource that I send out a lot. Another thing with John teamed up with CAQH and had a webinar at the WEDI conference. They reviewed the economics of the payments, the value-based payments, and went over various stages of the history from the Affordable Care Act all the way through the 21st Century Cures Act. So a lot of information on that. And then most recently, we worked on a value-based payment provider-focused survey and questionnaire that has been going out. We found that others were already doing a payer-based one, so we decided to jump in and do the provider side, and we'll team up and work there. Next slide. In the future, what we're targeting to do, obviously, is to grow our membership. We're looking to bring on a number of folks. Again, I work with a lot of operations folks that are, in the trenches every day, not only, shared savings and quality value-based payments, but a lot of capitation, partial capitation now with bonus payments. So it's a very complex market that's heating up. We also want to, and we're hearing from our clients, they're struggling with taking the health equity. So glad to see the new work group starting up, and would love to team up there with health equity. Clients of ours in the state of Oregon, OHA is pushing for a lot of that. As we all know, CMS has put a pause on the PCF Medicare until they were able to retrofit in specific functionality, and then has stated any new programs from CMS moving forward will be all focused on the health equity piece. So really looking to gain that. Obviously, we'd like to put out volume 2 of our Did You Know white paper, and then additional webinars coming up in the August Summer Forum and in October at the national conference. We'd love to also bring in some speakers from payers and providers that are using models and progressing their individual companies from fee-for-service to value-based payments. And the last slide. We meet fourth Tuesday of every month at 3. So love to have you join us.
Thanks so much. Now we're going to move on to the Administrative Automation Task Group with Dave and John.
Thanks very much, Pam. I'm Dave Haugen. I'm the co-chair of the Administrative Automation Task Group, the AATG, along with my fellow co-chair, John Zimmerman of Pull-On Solutions. And we went by the opening slide very quickly, but on the opening slide was a little graphic that says that this section is under construction. So this is a watch this space kind of a presentation. We hope, even though it's a little bit formative, that you will be interested, and that if you have some questions or some interest, please contact us as co-chairs or anyone at WEDI, and we'll try and give you any updates that you'd like. But with that in mind, going on to the next slide, please. The AATG is a little bit different in several ways than some of the other work groups you've just heard from. I think, one of the underlying contributors to the formation of the AATG is sort of a recognition that the US healthcare system has been described as being in crisis for over 30 years. One symptom of that crisis is really high and unsustainable administrative costs and burdens. And there are tremendous both needs and opportunities for some innovation and leapfrogging to shift from a paradigm of just administrative simplification to one of administrative automation. And in the process, to do that by really identifying and encouraging what we're calling sort of points of light, innovations and successful models to learn from and to replicate. And ultimately, where we would like to see the AATG go is that it can help in defining a clear, actionable path for stakeholders to move from manual to automated administrative processes, recognizing that the ultimate goals are really to reduce healthcare administrative burdens and costs, and to help improve the overall healthcare system to make it higher quality, more equitable, and more cost efficient overall. Next slide, please. So the AATG is formulating a particular approach to try and realize those goals. We will be working to identify some achievable opportunities and models and examples of innovations in practice to help move from manual to automated health data exchange. We're going to be highlighting and documenting and communicating some of those successful practices and innovations to help address and improve data exchange challenges. In the process, as we do this research, this highlighting and documenting and so forth, we hope to be educating the WEDI membership, the broader healthcare community, and others regarding some of these successful practices and models and innovations that we're discovering and researching. And also through the WEDI board, possibly recommending some of these practices and models to federal policymakers and the promotion of these models to WEDI membership and the broader healthcare community. Next slide, please. So we anticipate to meet the goals and the purposes we just talked about. We're going to be working with the task group when it's fully formed, WEDI members and others in the industry and the community to help identify important administrative automation issues, to identify and research promising or demonstrated solutions and successes and opportunities for improvements, and to really dig in deeply into the question of why. What was the rationale, the goals for the particular innovation or change? How was it sold at the C-suite level? To describe really the what's and the hows, what was undertaken and the results and the lessons, what were the impacts, what was learned, how replicable might this be? We intend then through the work of the AATG to really document our findings and our research and to share that for industry-wide success and also hopefully for momentum in continued success through white papers, webinars, roadmaps, a variety of potential recommendations to CMS and others. So a very, very active and I think especially proactive level of activity. Next slide, please.
So because we're still in formation, we have to look back in time a little bit immediately prior to the pandemic, when we had initially started the ETG concept. We had identified and showcased at a few WEDI events at that time some innovative attachments and prior authorization processes that were currently in use. The pandemic has slowed us down a little bit, and to some degree, we're kind of restarting and recalibrating. But at this point, we're completing initial planning and a prototype tool to really help focus the work of the ATG and to set priorities for needs and opportunities to explore through the ATG process. Next slide, please. So we don't have specific meeting dates and times at this point, although we hope to soon. Again, we are a work in progress, but we think we're moving pretty rapidly. So we hope you'll be interested. We hope if you have questions, you will certainly contact us or WEDI. And we look forward to meeting with you soon. Thank you very much.
Thanks, Dave. Now we're going to move on to the No Surprises Act task group with Stanley, Tom, Terry, and Beth.
Hey again. So the No Surprises Act work group task group was instated this year, maybe the very end of last year, the beginning of this year, in responses to the No Surprises Act, which started going into effect this year and in the future around a whole bunch of stuff, including privacy, price transparency, good faith estimates, dispute resolutions, and a whole bunch of other things. So next slide. All right, so the purpose of this task group is to review the legislative and regulatory requirements of the Federal No Surprises Act. We identify education, work products, and advisory needs. We collaborate with appropriate existing WEDI committees, work groups, sub-work groups on development of work products, and we collaborated with outside groups as needed. We gather documentation. We try to help solve for to inform HHS and CMS. We convene stakeholders, do surveys. We identify and make recommendations for best practices to help meet these legislative and regulatory requirements. We meet on the second and fourth Friday of every month. Next slide. We'd love to have you join us. We really need you to join us. There's a lot of activity and a lot of people who are routinely part of this meeting and contributing. Stanley, would you like to present our recent work products and what we're currently working on? And Terry, feel free to contribute as needed. Stanley still here? He may have had to drop.
Okay. Well, I can certainly jump in and just kind of.
Hold on a second. Can you hear me now?
Yes.
Okay. Yeah, I just got unmuted. So we've spent some time certainly understanding the requirements for the industry of the No Surprises Act and all of the questions that we still have. We support a blog on wedi.org. We have provided comments on the surprise billing part 1 rule, sent a letter to the Secretary of HHS in response to the requirements related to surprise billing part 2, and we've already had 2 educational summits on the No Surprises Act. And as implementation continues, we continue to work on a number of products. First, we now have a survey that's already out there.
Next slide, please, for standards.
Yes. We've created a survey to collect the input from providers in the rest of the industry on implementing the convening provider requirement portion of the No Surprises Act. That's certainly something that's kind of brand new to the industry, and we're really struggling how to do that. We're trying to get some input from the industry as to the difficulties, some of the challenges, and some ways to potentially implement that and provide some feedback to CMS as they make their decisions to when and how to implement these requirements of the law. We've reviewing the recent CMS frequently asked questions and providing additional questions and clarifications to those to CMS so that we can make sure the industry really understands what's going on. And we continue in our work group to have what we consider very relevant discussions on the continuing issues and the guidance that the industry needs, and hopefully the guidance that we can provide to CMS so that when they make those decisions, they're well informed and easily implemented. Beth, back to you.
Thank you. I did want to give, before we wind up, give Terry a chance to make any comments as another co-chair on this group.
Sure. I think you guys did a good job. I think would definitely love to get other people involved. As anyone who's been kind of diving into the No Surprises Act knows that there's a whole bunch of complexities and a whole bunch of issues that still need to be either resolved or just need to kind of be fleshed out. And I think this work group benefits from a wider range of perspectives. So hopefully some of you who have interest will join us.
Thank you. Thank you. I do want to point out the survey. It's a link in the WEDI emails that Sam's been sending out, and I provided the link here as well. That survey closes on the 20th. The more people that respond to this survey, the better. It's getting, it's very short. Get your feedback on your perceptions of the convening provider concept. So, and there's an explanation for that, and it's anonymous. So please do take a minute to do that survey. We would very much appreciate it. And that winds us up, Pam.
Thanks, Beth. So that's the last work group that we had to hear from. So again, thank you all for attending very much. We do have some WEDI events coming up here in just a couple of weeks. We've got the WEDI Spring Conference, which is virtual. And on May 23rd of that conference, we do have several of our work groups that will be holding work group meetings that are open to anyone that's registered for the conference. So take a look at that. And then in August, we've got our summer forum, which will be in person in Chicago. So we're very excited about getting everyone back together in person, seeing some friendly faces and sharing a lot of information. The agenda is coming out soon, but we've got a lot of really good content, including a day on the No Surprises Act there. So a lot of really good content that we're putting together for the summer forum. And you can get information on all of this at wedi.org. Also, information on all of the work groups that you've heard about today is available at wedi.org. And you can also reach out to Sam Holvey to get additional information. I am not seeing any questions come into the chat. I'll just give it one more minute to remind everyone, if you do have a question, please enter it into the chat and we can get that answered.
I'll just raise up. Thank you, Sam. She posted the survey link there in the chat. So that's a quick way. You take 3 minutes, go fill it out right now. You're done. We really appreciate it. Thank you.
And I do want to thank all of our work group co-chairs that participated today, that took the time to put together this information and then share it with you today. As you can see, we've got just a lot of great activity that's occurring across a lot of different topics. And if you can't find something that you're interested in all of these work groups, then I don't know, there's something wrong, because we've got so much going on with such varied topics. And we really encourage you to get involved in more than one. And if you are a WEDI member, then anyone from your organization can participate in any of these work groups and can participate in as many as you want to. So please join them all and participate, because we love to have participation in our work groups. I'm still not seeing any questions come into the chat, so we'll go ahead and close out. But again, thank you all for your attendance today. The recording and slides will be sent out after the session closes. And again, you can get additional information at wedi.org on all of the work groups that you heard about today. So thank you all very much for attending today.
Thank you, Pam. Thank you, Sam.